Hello everyone, my name is Maggie, and today I want to tell you about a disease that is near and dear to my heart. Imagine having your 6-month-old child crying hysterically, scratching every inch of their skin as much as they can with their tiny hands, and they're covered in a rash that seemed to appear overnight. You'd feel heartbroken that your child was in pain, and you'd feel helpless to do anything about it, as nothing that you did seemed to help them. You take them to the pediatrician, who informs you that they are suffering from atopic dermatitis, or as it is more commonly known, eczema. This was my situation a 1.5 years ago. It has been a constant struggle to manage my son's eczema, and I have tried to learn as much about this disease as possible. We have tried many of the treatment options I'm going to talk about today, and are always willing to try different ones in the future if they can help him. Eczema comes in many forms and can affect any age group. My focus will be mostly on eczema in children, as I have a personal connection with it. There are many pharmacological treatments available, as well as various alternative treatments. Today I'll be giving you a basic overview of what eczema is, what the symptoms are, who is prone to it, and how it can be treated. Though eczema can be a difficult disease to live with and manage, with various symptoms that come with each form of the disease, there are many different treatment options available to help those who are afflicted. First of all, what is eczema, and what are a few of the more common forms of the disease? To quote an article on eczema from the Mount Sinai School of Medicine, eczema is a common chronic relapsing skin disease characterized by pruritus, which is itching, disrupted epidermal barrier function, and immunoglobulin mediated sensitization to food and environmental allergens. Basically, the symptoms include itching, skin rashes, skin flaking, inflammation, and many other skin irritations. There are 3 stages of eczema: infantile, childhood, and adulthood. Some of the more common forms of eczema are psoriasis, cradle cap, and generalized exfoliative dermatitis, which is what my son was diagnosed with. Now that we know what eczema is and are familiar with a few of the more common forms, we can explore who is affected and why focusing more on the onset of eczema in children and infants. People of all ages can be affected by any of the various forms of eczema, though certain forms are age-specific. Something such as cradle cap, obviously, is usually just found in infants, usually clears up within a few months. According to Claire McCarthy, in a Harvard Health Review article, a national survey found that eczema rates in children in the U.S. rose between the years 2000 and 2010. They rose from 9% to 17% in African American children, 5% to 10% in Hispanic children, and 8% to 13% in non-Hispanic Caucasian children. In both the article by Claire McCarthy and the article from the Mount Sinai School of Medicine, most cases are diagnosed before a child's 5th birthday. My son was diagnosed at 6 months. Eczema is, for the most part, a result of genetics, as stated again by the Mount Sinai School of Medicine. While there are some cases that result from environmental and food allergens, genetics seem to be the major culprit. It certainly was in my son's case, as both myself and my aunt suffered from severe eczema as children. So now that we know what it is, who is affected, and why are some more likely than others to get it, what can be done to treat and manage this disease? In an article found in Clinical Reviews in Allergy and Immunology, there were many treatments for eczema listed, as well as the benefits and risks that go along with them. The article stated that in the 1800s, eczema was treated with dust powders, cold compresses, rest, and ointments such as zinc, tar, and lanolin. Though options obviously were limited by the medical technology available during that time, some of these treatments are still used, such as cold compresses and lanolin. The most common treatment today for eczema would be corticosteroids, the most well-known of which are hydrocortisone creams, which can be taken in different strengths. Usually you get the 1% at the store, and to get anything stronger, you usually do need a prescription. There are some risks to consider with this form of treatment. Corticosteroids can cause hypertension, diabetes, nausea, vomiting, and skin rashes, but these risks are low for those who do not use these corticosteroids systematically. Often lotions and ointments, such as Eucerin, Aquaphor, Vaseline, are recommended to be used in conjunction with the corticosteroids. There are also a number of alternative treatments available. In a short article that I found in Contemporary Pediatrics, Dr. Peter Leo briefly discussed 3 alternative treatments: sunflower oil, coconut oil, and acupressure. The first 2 lack many of the side effects of many of the pharmacological treatments and really only present a problem if somebody is already allergic to either sunflower seeds or coconuts. Acupressure can be done at home after having a physician teach you how to do it properly, and it has been effective for some in relieving the itching that is prevalent in most forms of eczema. I have actually used all 3 treatments on my son in a combination with a prescribed hydrocortisone cream, and they have all proven to be quite effective, although he still seems to flare up when the weather changes. All treatments should be applied on a case-by-case basis, as no 2 cases are ever exactly alike. In conclusion, though eczema is a fairly common disease, especially among young children, it can be treated and managed. It can come in different forms with varying levels of severity, though each person affected should come up with their own unique treatment plan in conjunction with their physician. Though I know that my son may suffer with this disease for many years, I take comfort in the fact that there are many different treatment options for us to try and extensive, ever-expanding research on this disease. Thank you.